Welcome. My name is Margaret Conger. I am a certified yoga instructor, CNA, and my expertise are in biofeedback, yoga, meditation, and breathing techniques. Today I will be presenting on stress, its effects, and proper management. I will be discussing the history of stress, defining stress, the autonomic nervous system, a term called overbreathing, ways to manage stress, and then we will finish with an exercise. The history of stress. The term stress was coined by Hans Selye in 1936, who defined it as the nonspecific response of the body to any demand for change. Stress was generally considered as being synonymous with distress, and dictionaries defined it as a physical, chemical, or emotional factor that causes bodily or mental tension and may be a factor in disease causation. Thus, stress was put in a negative light and its positive effects ignored. The National Institute of Mental Health states, stress is how the brain and body respond to any demand. Every type of demand or stressor, such as exercise, work, school, major life changes, or traumatic events, can be stressful. Stress can affect your health. It is important to pay attention to how you deal with minor and major stress events so that you know when to seek help. The 5 things everyone should know about stress. 1. Stress affects everyone. 2. Not all stress is bad. 3. Long-term stress can harm your health. 4. There are ways to manage stress. 5. If you're overwhelmed by stress, ask for help from your health professional. Illustrated here is the human function curve. This shows increased stress results in increased productivity, up to a point, after which things go rapidly downhill. However, that point or peak differs for each of us. We all have our own limits, and it is understanding those limits and how to use stress to our advantage and avoid going down that hill. Signals of stress also differ for each of us and can be so subtle that they are often ignored until it is too late. For example, I carry stress in my shoulders. I used to have no idea or awareness of my stress until someone would come up behind me and touch my shoulders, and then wow, I realized how much tension I was holding. Now I have exercises I practice to recognize if my body is responding negatively to stress, and then I know something needs to change. The roller coaster analogy. I think the roller coaster analogy is a good example of our limits and why the same stressor can differ so much for each of us. Pictured, we have the same event with different reactions. On the right, we have good stress, and on the left, we have distress. The distinguishing factor is the sense of control they have over the event. While neither picture had any more or less control, their perceptions and expectations were quite different. Many times we create our own stress because of faulty perceptions, and this is something you can learn to correct. While everyone can agree on a definition of stress, all of the experimental and clinical research confirms that the sense of having little or no control is always distressful, and that's what stress is all about. Any definition should also include good stress, and your perception of stress can be the distinguishing factor between good stress and distress. I do want to point out in my presentation today, when I refer to stress, I'm referring to distress unless otherwise noted. Nobody can make you feel inferior without your consent. I thought this quote was effective in explaining perspective. Your perspective of stress drives how you feel about it. No one can make you feel stressed. They can evoke stressors, but it's up to you to decide how to interpret and manage it. This is something to keep in mind the next time you find yourself responding negatively to someone or something out of your control. You choose how to respond and react. How does stress affect the brain and body? Bear with me as I explain this diagram. The nervous system consists of 2 main parts. the central nervous system and peripheral nervous system. The central nervous system consists of the brain and spinal cord, while the peripheral nervous system consists of the nerves and ganglia outside the brain and spinal cord. The peripheral nervous system serves as a relay between the brain and spinal cord and the rest of the body. There are two branches of the peripheral nervous system. I want to focus on the autonomic nervous system, which is comprised of the sympathetic nervous system and parasympathetic nervous system. Under sympathetic dominance, this is what happens to specific organs, as you can see on this diagram. Your pupils dilate, salivation is inhibited, your heart rate accelerates, digestion is inhibited. This is your fight or flight response. Under parasympathetic dominance, this is what happens to specific organs. Your pupils constrict, salivation is stimulated, your heart slows, digestion is stimulated, and your bladder contracts. This is your rest and relaxation response. To sum up your autonomic nervous system, the general action of the sympathetic nervous system is to mobilize the body's fight or flight or freeze or appease response and control the body's response during perceived stress, while the general function of the parasympathetic nervous system is control homeostasis and the body's rest and digest response, and controls the body's response while at rest. Do you have a balanced autonomic nervous system or a dysregulated autonomic nervous system? Back in the day, when faced with a tiger, there were 4 options: fight the tiger, flee from the tiger, get eaten by the tiger, or the most obvious, run faster than your friend. Either way, in more primal days, we didn't remain stressed over situations or events after a scenario played out. Our sympathetic nervous system shifted to parasympathetic nervous system dominance, and our autonomic nervous system and homeostasis were restored. In today's culture, most times we never make the shift from sympathetic nervous system to parasympathetic nervous system. Present day, we get stressed over mundane tasks like going to the grocery store. The traffic is awful getting there. There's construction, sirens, horns honking. We can't find a parking spot. You get into the grocery store and you forgot your list. Your phone starts ringing and texts are coming in. They're out of organic OJ and grass-fed beef. People are crashing into your cart, the line is forever long, and the person in front of you has a ton of coupons and the cashier needs assistance. I'm stressed just talking about it. Nowadays, a text message is the new tiger. And rather than facing one tiger every once in a while, we are facing the tiger consistently throughout every day. How many texts, emails, phone calls do you receive per day? We are living in a more sympathetically driven state more consistently, faced with stressor after stressor without recovery or restoring balance. This is more than our bodies can handle and is wreaking havoc on our brain and body. So what are some examples of stress in your life? A demanding boss, your marriage, carpool, elderly parents, holidays. Everyone gets stressed over the holidays. A public speaking event. I can say my sympathetic nervous system is activated now. I feel my heart rate is up, my palms are a little sweaty, but I'm using this to my advantage. How? My perspective. Rather than prepping myself with, I'm so scared and nervous, I'm going to mess up, I've been prepping myself with, I'm so excited to share this knowledge and spread my passion to others. Rather than feeling distress, I feel good stress. This slide is brought to you by HeartMath. The HeartMath Institute has been researching stress, the effects of stress and stress management since 1991. They have developed a number of tools to help manage stress and restore balance and homeostasis. The HeartMath device is a biofeedback tool used to increase what is called heart rate variability and decrease stress and its side effects. We at Carolina HealthSpan promote the use of HeartMath daily. Out of curiosity, how many of you have been asked by your doctor about your level of stress? What did they recommend? Or did they? Medication? A frightening statistic, 60 to 80% of primary care visits are related to stress, yet only 3% of patients receive stress management help. As this slide shows, stress affects every organ in our body and manifests in different ways, be it physically, emotionally, or psychologically. Manifestations include headaches, attention deficit disorder, irritability, jaw tension, arrhythmias, weight gain, decreased sex drive, and more. Stress is the #1 proxy killer disease today. Stress is the basic cause for more than 60% of all human illnesses and diseases today, including heart disease, obesity, Alzheimer's, diabetes, depression, asthma, gastrointestinal problems, premature death, and more. So what do you think? Do you have stress in your life? Would you like to learn how to manage and live a more balanced life? So how do you manage stress? First of all, awareness. Simply having awareness of our perception and reaction will allow us to better manage our stress. Understanding proper techniques to manage stress and devising a strategy to manage stress. The first step in managing stress is having awareness. I spoke earlier about your perception. You must be aware of your mindset in order to shift your mindset. Start bringing awareness to your thoughts. What story are you telling yourself? How are you perceiving interactions, your environment, and encounters? If you recognize you're in a negative thought pattern, you then have the ability to shift or change that pattern. For example, you're in traffic. You're breathing shallow, rapid, you're white-knuckling the steering wheel, tensing your shoulders and cussing the person in front of you. Are you even aware of this response and reaction? If so, next time you are in this scenario, shift your perception of traffic. Try this approach. I am here. I have no control over the traffic. I will take this time to practice those new breathing techniques. Call my mom, call my best friend, listen to an audiobook or a podcast. How will reacting to the traffic serve you? There are a number of approaches that will calm your nervous system rather than increase stress. So begin by bringing awareness to your physiological response to stress. Pay attention. Are you breathing deeper, palms sweaty? Do you have muscle tension? Are your shoulders up by your ears? Is your heart racing? These are all signs of an activated sympathetic nervous system. Techniques to abate stress include diaphragmatic breathing, mindfulness, biofeedback, heart math, journaling, meditation, and yoga. This is a photograph of me meditating at the top of Nevada Falls in Yosemite National Park, depicting most any of these techniques can be practiced absolutely anywhere. Diaphragmatic breathing is one of the best techniques you can use to help manage stress and balance your autonomic nervous system. The primary and most consistent response to stress is dysfunctional breathing or overbreathing. Most adults have dysfunctional breathing patterns and are completely unaware of the effect it has on their body. I want to take a few minutes to explain dysfunctional breathing and then teach you how to overcome dysfunctional breathing with diaphragmatic breathing. What is overbreathing? Overbreathing is the behavioral mismatch of the rate and depth of breathing, resulting in ventilating out too much carbon dioxide, lowering blood levels of carbon dioxide, and leading to a condition called hypocapnia or lack of carbon dioxide. Most people think I'm not getting enough oxygen, when really it is a lack of carbon dioxide. Hypocapnia, or lack of carbon dioxide, disrupts the body's acid-base chemistry, electrolyte balance, blood flow, delivery of oxygen. Hypocapnia can trigger, cause, or exacerbate physiological and psychological issues, including anxiety, panic, anger, chronic pain, headaches, asthma, GI distress, and more. Hypocapnia starts out as a reaction to a stressful event or difficult emotions and is maintained through learning or habit. Stressful situations can include a concussion, car accident, tough breakup, abuse, surgery. These and any other examples can cause dysfunctional breathing patterns and disrupt one's autonomic nervous system. Until you are trained in proper breathing mechanics, one does not recognize present symptoms can be due to hypocapnia or even how to overcome. Once you are trained in proper breathing mechanics, you can begin to correct hypocapnia. Overbreathing affects your performance, causing difficulty concentrating, difficulty making decisions, a fuzzy mind, shortness of breath, muscle tension, lightheadedness, dizziness, blurry vision. So what is normal? Tasks in normal respiration include getting adequate saturation of blood with oxygen, adequate saturation of blood with carbon dioxide dissolved as carbonic acid, maintain pH level of blood between 7.35 and 7.45, removal and retention of alkaline and acidic products by the kidneys, and maintaining breathing drive at optimum levels. So why is carbon dioxide important? Again, we typically think of oxygen being important, but rarely do we think about carbon dioxide. Carbon dioxide is produced during cell metabolism. It regulates pH levels vital to the distribution of oxygen. Brainstem receptors respond to levels of carbon dioxide, but not oxygen. 85 to 88% of blood carbon dioxide is retained and reallocated for acid-base regulation. At rest, only 12 to 15% of blood carbon dioxide is excreted. Here is a breakdown of normal respiration versus overbreathing. In normal respiration, when there is a natural increase in metabolism, the production of carbon dioxide increases and pH levels drop, causing hemoglobin to release oxygen to tissues with higher need, and more oxygen therefore reaches tissues and organs. In overbreathing, increased ventilation of carbon dioxide without an increased metabolism causes a decrease in carbon dioxide levels in blood and increases pH levels. Then the hemoglobin does not release sufficient oxygen, and there is a lack of oxygen to tissues and organs. This image depicts your brain on normal respiration versus your brain on overbreathing. The image on the right shows lower brain oxygen levels due to reduced carbon dioxide values. Symptoms of acute overbreathing include shortness of breath, chest tightness, sweatiness or shivering, increased heart rate or heart palpitations, nausea, dizziness, blurred vision, and more. Symptoms of chronic overbreathing include panic disorder, heart arrhythmias, sleep apnea, IBS, chronic fatigue, asthma, generalized anxiety disorder, chronic anger, and more. My personal experience with hypocapnia was after a series of major life events. I experienced shortness of breath, generalized anxiety, and excessive yawning. I was completely unaware what was causing these symptoms and dismissed them until I attended yoga teacher training and was taught proper breathing mechanics. And then through biofeedback training, I understood the science behind what I had experienced, how I overcame it, and with utilization of proper tools have been able to sustain the benefits of proper breathing ever since. Skills for healthy breathing. So how do you fix overbreathing? First, some healthy breathing basics. Match between metabolic needs, carbon dioxide production, and size and rate of breath. You need to maintain proper breathing chemistry with any level of activity and any rate of breathing. Fast breathing rate does not mean that there is overbreathing, but there is a correlation. And slow breathing does not mean breathing is healthy, but there is a correlation. Diaphragmatic breathing or low and slow breathing is how you overcome overbreathing patterns. Overbreathing often starts out as a reaction to a stressful event and or difficult emotions, poor posture, or traumatic events and is maintained through learning or habit. Most people are breathing with their chest, clavicle area, or even reverse breathing. If you picture where your lungs are in your body, breathing with your chest does not nearly fill your lungs. However, breathing with your diaphragm allows the space to expand and fill your lungs fully. Note, deep breathing for the purpose of calming down is often associated with unintentional overbreathing. A deep breath has greater tidal volume than a typical breath, and taking several deep but fast breaths is the best way to overbreathe. If you breathe in more, you breathe out more, with no increase in oxygen demand or in carbon dioxide production, which leads to breathing out too much carbon dioxide, which equals overbreathing. So in order for breathing to be calming, the size and rate of the breath have to correspond to the metabolic needs of a resting state. By utilizing your belly or diaphragm and slowing down your breath rate, you can restore proper carbon dioxide and oxygen balance, and with daily practice, you can overcome hypocapnia or overbreathing. Before teaching diaphragmatic breathing, I would like everyone to watch this video to have a better understanding of the anatomy behind diaphragmatic breathing. Now I'd like you to join me as I lead you through a diaphragmatic breathing exercise. To begin, you can go ahead and either lie down, knees slightly bent, hip distance apart, or legs flat against the ground, or you can find a comfortable seated position. Place your left hand over your heart and right palm on your belly near your belly button, and begin to breathe comfortably for a few moments. Notice the quality of your breath. Is it tense, strained, uneven, shallow? Maybe it is smooth and relaxed. Bring awareness to your breath. Observe the breath. Gradually begin to make your breathing as relaxed and smooth as possible. Begin inhaling through your nose and exhaling through your nose. Even inhales as exhales. Now introducing a slight pause after each inhale and a slight pause after each exhale. Once the breath feels relaxed and comfortable, notice the movement of the body. As you inhale, your abdomen or belly expands. As you exhale, you feel a slight contraction of the abdomen or belly. Now continue with this breath for a few moments, inhaling, expanding your belly, exhaling, contracting your belly. Keep in mind that your body knows exactly how to breathe low and slow. When you are a baby and a young child, you are breathing this way all the time. You have a few years of practice. This is kind of like riding a bike. You don't forget how to do it. You just need to let your body do what it knows how to do. Stick with the breathing another few moments. And when you're ready, slowly open your eyes. Good job. How do you feel? Many people say calm or relaxed. Others may claim, that felt awkward, but I feel calmer. That is you calming your nervous system on your own simply by breathing. And now that you may feel a nice and calmness, I want to discuss some additional techniques for managing stress. These are hot topics and are frequently being talked about. Mindfulness and meditation. First of all, what are these and what is the difference? Mindfulness and meditation are similar and overlapping, yet separate practices. We can start by debunking two common myths. Mindfulness is not thinking really hard about something which sounds stressful, and meditation is not about shutting down the mind like an off switch, which sounds boring. Both practices are life skills that give you the tools to access inner peace, which is already inside of you. Both rely on the ability to be focused entirely on the present moment. We can't experience peace when we regret the past or worry about the future. Both practices offer a way to increase happiness and decrease stress and decrease suffering. Mindfulness. Mindfulness is a way of being actively aware of what you're doing while you're doing it. When unawareness dominates our mind, all our decisions and actions are affected. Quote by Jon Kabat-Zinn. Society's obsession with multitasking often leads us too much at once, without focusing fully on each stage of the experience. Lack of awareness also prevents us from listening to our bodies when they need nutrition, rest, exercise, or hydration. Being fully aware and engaged in an activity can make a situation less stressful because it initiates a perspective free of judgment. When practicing mindfulness, the mind isn't guessing at the future or creating a mountain out of a molehill. Living mindfully means that we experience life with a beginner's mind. This means listening to someone with full attention to their words, voice, and feelings. Listening as though it were the first time you ever met this person or heard them speak. Mindful listening improves our relationships because listening with patience, trust, acceptance, and an open mind strengthens our ability to communicate. Compassionate communication coupled with more conscious control over our emotions can be monumental to personal growth and relationships. Mindfully responding to stress instead of reacting habitually is called mindfulness-mediated stress response. Meditation. Meditation is a formal practice of finding peace within. Awareness of peace is achieved when mental chatter is decreased. There are varying types of meditation. All forms of meditation give our mind something to focus on, and when we give our mind something to focus on, be it a guided meditation, the breath, or a mantra, we become aware of an inner world of stillness, love, and peace. In addition to being the perfect way to let go of stress, meditation has many health benefits, including strengthened brain function, increased physical vitality, and better sleep. Merging the two practices. Combining the informal, wakeful awareness of daily mindfulness with a formal meditation practice can be a potent stress management tool. Each practice enhances the effectiveness of the other. With meditation, you are more aware of the inner world of your thoughts, bodily sensations, sounds, and energy, while at the same time being mindful of a silent mantra. Meditating first thing in the morning for 5 to 10 minutes and then at the end of the day to release any accumulated stress. People around you may notice the benefits even before you do. Practicing mindfulness and meditation goes hand in hand with creating a happy, reduced stress life. Mindfulness and meditation may sound easy, but for most they are challenging, especially at first with all the distractions we have in our daily lives. Starting a practice, understanding your mind will race and you will get distracted, but coming back to the practice as you recognize your mind has wandered and not get frustrated, and stick with it. This video is an excellent depiction. So, now that you have an understanding of some of the basic techniques, you need to devise a strategy. First, understand your physiology when you feel stressed. Identify triggers for stressful situations. Write them down. Categorize them into momentary stressors or lifelong stressors. Anxiety due to a long-term bad relationship, long-term stressor. Traffic jam, short-term momentary stressor. Pair the techniques with a stressor. Long-term stressor can be helped with biofeedback. Maybe you need more than just breathing techniques, whereas diaphragmatic breathing is all you need to overcome your short-term traffic jam stressor. Lastly, what is Carolina Healthspan's approach? At Carolina Healthspan, we systematically measure to understand which one of your physiological responses is your biggest problem, and then eliminate that problem while giving you targeted things to work on. We measure via an assessment called a biomap. A biomap consists of placing sensors on your body to read your physiological response to stress and how you recover from stress. The sensors read your breath rate, muscle tension, peripheral temperature, and heart rate while putting you through a series of stressors followed by a recovery period. The physiological responses that do not recover from stress will determine the modalities we use for therapy. Therapy consists of biofeedback sessions. Biofeedback provides you with tools to self-regulate your autonomic nervous system and physiological response to stress. In sessions, you will also learn how to apply mindfulness, meditation, and other tools in your daily life to help facilitate a strong and homeostatic body. If you have any questions, please contact me at margaret@carolinahealthspan.com. Thank you for joining.